so much. This is National Public Health Week, and while we all became a little more familiar with the concept during the COVID pandemic, that's not all public health is about. Ashley Goss is the Kansas Department of Health and Environment Deputy Secretary for Public Health, and Christy Kane is KDHE's Local Public Health Program Director, and they are here to give us a little more insight. We appreciate you taking some time to be here today. Ashley, public health, the concept itself, what does it even mean?
The concept itself, the way I like to explain it is it's what's going on behind the scenes quietly every day, all day, 7 days a week, 365. We're looking out on how we can protect our community and our population.
And this isn't something that just came up when the COVID pandemic. It's not just about viruses. What other sorts of things do you deal with?
Right. Definitely not just about viruses. Pandemic is something we do not want to repeat anytime soon. So we work on preparedness. So getting people prepared for severe weather and how to keep their family prepared and have things in place if that were to happen. On the health department, with the health departments, having them know what to do if, say, there's a tornado. Health departments a lot of times will provide tetanus vaccines to communities that have been devastated by a tornado. Same with if there's flooding. Immunizations, of course, is something else that we do. School physicals can be healthy physicals. We do referrals also as well for different sorts of things. It depends. I like to say, out of all of the health departments in Kansas, if you've seen one, you've seen one. They all do things catered to their communities.
And Christy, that's kind of where you come in. You work with the local health programs. What sorts of programs have you been helping administer across the state? And I guess I'm thinking in part of the local health rankings that came out county by county, and it dealt with things like smoking prevention, diabetes, obesity, maternal health, and babies. I mean, what sorts of things are you working with counties on?
Right. So as Ashley mentioned, counties work on a variety of things tailored to their counties, and my program supports the 100 local health departments that serve all 105 counties across the state. And so just a range, like Ashley mentioned, the preparedness aspect is one, but just there's a huge breadth from addressing things like food insecurity, transportation issues, access to care. So it's a really broad range of services that communities provide that we're helping them implement in their communities.
How much demand do you see for some of those services and programs?
So, I mean, I would say that sometimes the community may not know that they need it yet, if that makes sense. And so public health is really kind of the umbrella over health, big picture public health. And so, like, whereas a physician helps one person and diagnoses one disease, public health is looking at, okay, why are these people all getting the same disease in the same area, things like that. And so we're looking at, so why are people in this zip code dying 20 years earlier than the people in the zip code right next door, which is happening in our country. And so really bringing a community together to address whatever their issues are. I was just listening to a podcast today where the Surgeon General was talking about how loneliness is a public health epidemic. So everything from gun violence can be a public health issue in many communities. So it's really tailoring it. So what is going on in that community that's impacting the public health, and then pulling together the right partners and people to address it. So partnerships are huge in public health, and I see public health as they're kind of the health strategist, where they bring together the partners. They don't do all the work themselves, but they bring the community together to make sure the work happens.
And we can debate pros and cons of what came out of the pandemic and how people felt about certain policies or processes and procedures. But on the plus side, Ashley, what did we learn from the pandemic that maybe has improved some of those relationships between local and state and community partners?
Those are some of the positives that came out of the pandemic. So we have learned how to partner in unique ways. So, I mean, many of us had to learn how to partner via Zoom and figuring that out, and problem solving with community members, different times of day, but community partners that maybe we hadn't seen before or heard from. At the state level, meeting with new sister agencies or even new partners of coming together to develop a plan and learning that everyone just kind of leaves where they're from at the table, and we're all there to serve one purpose, which is how to make our state safer and get through that.
Good lessons in communications for moving forward now and addressing some of these other issues now that we can kind of move on from COVID?
Absolutely. I think there's great lessons that we learned in communication. It's all positive, all positive.
So we can continue to improve on all the other aspects moving forward. Ashley, Christy, thank you so very much, and happy National Public Health Week to you. Appreciate
Thank you so
being
much
here.
for having us.